हेलो फ्रेंड्स, आपका मेरी यूट्यूब चैनल साइंस क्लास में स्वागत है। तो आज मैंने नर्सिंग फाउंडेशन के ऊपर नोट्स प्रिपेयर किए हैं, तो शुरू करते हैं। Waste management is crucial to promote high quality of the healthcare and safe environment within the hospitals. Medical waste is any waste occurring as a result of medical services and scientific research in medicine. In general, the amount of waste generated by healthcare activities is 80% general waste and the remaining 20% is hazardous material. World Health Organization WHO divides medical waste into seven categories: infectious wastes, pathological waste, sharps, chemicals, pharmaceutical, genotoxic, and radioactive waste. The most important factors that should be considered waste management system are collection systems in the generation site is segregation system of containers and bags, time and temperature of temporary storage generation site, transport requirements, central storage conditions, and approved disposal methods. Noise is defined as unwanted sounds. Several studies have been conducted for hospitals noise that linked hospital noise to a variety of negative physiological outcomes. The WHO has recommended that noise levels should not exceed 35 dB in the rooms where patients are treated or observed and 30 dB in the ward rooms. In 1974, the US Environment Protection Agency (EPA) suggested that the peak noise level in a hospital should not exceed 45 dB during the day and 35 dB at the night. Hospitals have various sources of noise such as alarms, paying systems, telephone, computers, printers, televisions, air conditioner systems, door opening and closing, and surrounding system of the course. One physical effect of the noise of a human stress which should be avoided in the environment. To overcome the problem of the noise within hospitals, some preventive procedures should be carried. One form is to measure the noise level periodically to reduce the patient's exposure to such noises. Another approach is to perform a regular checkup and maintenance to all systems that are considered as the sources of noise, including equipments. Also, some practices could reduce noise level. This includes obligations of the instructions in critical areas such as intensive care units, making clear circulation path for patients and staff, and well training for services providers such as housekeeping. Infection control. Infection control provides a framework for identification of a hazard and development of an action plan to eliminate the hazard or minimize its effect through control measures, education and training, surveillance of the infection, policies, procedures and guidelines, adult processes, documented arrangements, monitoring of hospital hygiene. The WHO has classified infection practices into two main categories: standard precautions and additional transmission-based precautions. Standard precautions includes the following items: hand washing and antiseptic is hand hygiene, use of personal protective equipment when handling blood, body substances and secretions, appropriate handling of patients' equipments and solid linen, prevention of the needle stick, sharp injuries, environmental cleaning and spills management, and appropriate handling of waste. Additional transmission-based precautions, while ensuring standard precautions include airborne particles precautions, droplet particles precautions, and contact precautions. Radiation safety. The medical safety program is adequately protects patients, caregivers, visitors, and general public to minimize accidental exposure hazards in ionizing medications and fundamental principles in radiation protection should be identified as existence of radiation safety program that cover and safety the following activities: regulatory activities related to radioactive materials and multi-level relation safety training, monitoring of occupational radiation doses of personnel, control of the radioactive materials, active participation in planning of new or remolded facilities, response and investigation of the incidents, accidents, quality and measurement programs. Time, distance, and shielding are other critical elements. Radiation time. The simplest method for protection from ionizing radiation is to spend as little as possible in the vicinity of the radiation source. In addition, reducing the exposure time to one half reduces the dose received by one half. Damage, that is distance. Doubling the distance between the person and the source helps to reduce the exposure to a quarter of its original value. And shielding. Shielding is considered as the most significant line of defense. The more mass that is placed between source and a person, the less radiation the person will receive. तो देखते रहिए मेरे चैनल को, लाइक कीजिए, सब्सक्राइब कीजिए। मिलते हैं मेरे नेक्स्ट वीडियो पे।